offense.
Good afternoon and welcome to the NC Health Connect's TeleTownHall. We have some exciting and important information to share with you today. Before we begin, I'd like to run through a few housekeeping items. Due to the limited amount of time allotted for this presentation, we will be putting everyone on mute. If you have questions, please utilize the chat feature within the WebEx. Click on the chat icon shown in the red square, then type your question in the text box as shown in the red rectangle. We will try to address questions at the end of this presentation. If you have questions specifically related to your practice, we will contact you individually to answer those questions. Otherwise, feel free to reach out to us directly. We will provide you with our contact information at the close of today's presentation. We have had some issues with the mute feature, so if you would please take a moment and mute yourself, that would be helpful. We are hearing some noise in the background. Thank you. Over the next hour, we will be covering the topics listed here. We'll introduce staff from both the NC Authority and the SAS technical team. Kelly McDonald with the NC Health Connect will give an A to Z review of the NC Health Connect program, and I will present the NC Health Connect portal account management and then the quarterly user account audit. At the end of today's presentation, we will have an opportunity for questions and feedback or suggestions for future TeleTown halls. Okay, let's get started with some introductions. From the NC we have Kelly McDonald, Provider Relations Specialist. From the NC Health Connect SAS Help Desk team, we have Arn Koda, Team Manager, and the Technical Support team, along with my associates Terrence Atkinson, Josiah Berryman, and myself, Holly Elliott. We're all Technical Support Analysts. And now I will turn the presentation over to Kelly, who will provide an overview of NC Health Connect along with some important updates.
Thank you, Holly, and to everyone who has taken time to join us today. As you all know, the North Carolina Health Information Exchange Authority is the body of people who governs the law and manages the state-designated HIE and portal we call NC Health Connect. We work very closely with our technical partner, SAS Institute. Up until a few months ago, all providers of Medicaid and other state-funded programs, including the state health plan, were required to connect to NC Health Connect by June 1st of 2018 or 2019. A couple of changes to the mandate were established during short session this past summer. The changes to the mandate state that dentists and ambulatory surgical centers are now required to connect and send clinical and demographic data by June 1st of 2021. Pharmacies also have until June 1st of 2021 to connect, and they will be required to submit claims data.
We are getting some feedback from someone on the phone. If you would please take a moment to put yourself on mute, that would be helpful. Thank you.
According to the legislation, in order to be in compliance with the law, you must be submitting data to NC Health Connect. For our participants who have already requested an extension, you will notice a change in our new extension process. The biggest difference with the new extension process is there is no need to submit a form. Participants who are in the queue to connect and are moving forward in the technical process will automatically receive an extension and remain in compliance. This means for participants who are mandated to connect by June 1st of 2019, you will automatically receive an extension if you are still in the queue to connect on your deadline. Please note, in order to receive or keep an extension, participants must show good faith effort to connect. This means you must have a valid participation agreement on file and remain responsive with the NC Health Connect and our technical team at SAS Institute. The extension is not a waiver, but simply an extended period of time to complete the connection process.
We're still getting some feedback from people on the call. Please mute your phone. Thank you.
In the next few slides, we will update you on the types of providers that are connecting to NC Health Connect, what to expect after you've submitted your participation agreement, and information on the patient opt-out process. We have made significant strides in onboarding and connecting practices to NC Health Connect. We have over 4,000 facilities connected. The term connected means these practices are live in production and are sending data to NC Health Connect. We also have over 3,900 facilities in the onboarding process. When a practice is in the onboarding process, they have an executed participation agreement and are in the queue with our technical team who is working towards building their connection. This slide gives you a snapshot of the many different types of providers we are working with across the state and helps create a picture for whole person care. It explains that we work with all provider types, recognizing that each provider type may have unique data standards. As we mentioned in the previous slide, connected means a practice is live in production and sending data to NC Health Connect. The connection process takes an average of 3 months, and quite a bit happens during that time period. The first communication you receive from us after your executed PA is the welcome packet. The welcome packet includes patient and provider education materials, as well as a sample notice of privacy practices. This packet should have been emailed to you immediately following the email you received with your executed PA. Next, participant account administrators with a full participation agreement will receive credentials to the portal. Your practice's data will not be in the portal quite yet. However, your providers can go ahead and start querying their patients for treatment purposes. Simultaneously, your technical point of contact and EHR contact will begin conversations with our technical team at SAS Institute. It is extremely important for all parties to remain responsive during this process so the connection build can move forward. Once the technical build and testing are complete, your data will start flowing to NC Health Connect and you will be live in production. You will get a live connection email from our team when your connection goes live. As I mentioned previously, the connection process takes an average of 3 months to complete. We encourage you to begin educating your patients about NC Health Connect as soon as you receive your welcome packet. Educational materials about the opt-out process are included in this packet. It is each provider's responsibility to educate their patients on NC Health Connect, as well as the patient's right to opt out. North Carolina is an opt-out state, which means that patients are opted in until they exercise their right to opt out. A patient only needs to check the resend opt-out box if they were previously opted out and now want their data to be sent to NC Health Connect. Once we receive a completed opt-out form, we process the request within 2 business days. Please note, all of the fields on the form must be filled out in order for us to process the opt-out. Once the patient has been educated, it is the patient's responsibility to complete and submit the form if they choose to do so. There is nothing the provider has to do here. Patient education materials are provided in the welcome packet with a sample notice of privacy practices, flyers, talking points, a brochure order form, and copies of the opt-out form in English and Spanish. The welcome packet also includes templates for employee education, such as sample newsletters and emails. If you would like a copy of the welcome packet, please email HIEA@nc.gov. NC Health Connect has a suite of services for its full participants. We're going to touch on just a few of these services in the upcoming slides. We have such a rich data source here in North Carolina. We are lucky enough to have a centralized state HIE that is mandated by statute. This allows the providers of North Carolina to have access to their patients' data in one central location, regardless of which hospital system, EHR, or health network their patient is a part of. We are in the infancy stage of leveraging this data to provide better care to the citizens of North Carolina. We currently have registries for diabetes and immunizations, which are used for surveillance and treatment purposes. If you are interested in connecting to a registry through NC Health Connect, please contact us at HIEA@nc.gov. We are integrated with our controlled substance reporting system and are working to fight the far too prevalent opioid crisis in our state. We are also looking into the possibility of a registry for ECQM, electronic clinical quality measures, so our providers can see which of their patients fall into and out of certain measures. Direct Secure Messaging, or DSM, is an encrypted email tool that allows a clinician to send protected health information about his or her patient through a secure network to other providers with a DSM account. Our provider DSM directory currently has over 21,000 provider DSM addresses. For our providers who are already using DSM, we want to let you know that NC Health Connect is in the process of switching direct vendors from Orion to SES and expect this to be a seamless transition. You will receive more information about this transition and the benefits you will notice with SES. However, a couple of these benefits include increased reporting capability for meaningful use and better visibility into your practice's DSM usage. If you have a full participation agreement and do not have a DSM account, we are happy to help you set one up at no charge. Please contact our help desk team at HIEsupport@sas.com. We are very excited about our new NC Notify service and know it will help with some of the challenges our participants have shared with us. A few of these challenges include knowing where their patients receive care outside of their organization or EHR, limited patient search capabilities in the clinical portal, and ensuring and supporting successful transitions of care if they are not notified of events in a timely manner. How does NC Notify work? Initially, NC Notify will use hospital ADTs and visits from all other participant facilities as triggers for the notification. Participants registered for this feature will provide a list of patients with whom they have an existing relationship via a flat file. NC Notify will scan NC Health Connect for activity on the defined patient panel and provide batch reports at custom delivery intervals back to the participant. If you would like more information on NC Notify, please visit our website at nchealthconnect.gov. Click on the For Providers tab, and then click on the Notifications link. Here you will see benefits of NC Notify, how it works, frequently asked questions, as well as the enrollment form. In addition to NC Notify, you can find a wealth of information on our website. The home page has links to some of our most frequently visited pages. If you look at the blue ribbon at the top of this page, you will see a link called For Providers. The For Providers link opens a page that was created just for you. NC Notify can be found under the Notifications link in the middle of the page. This is where you will find more detailed information on NC Notify as well as the enrollment form. If you would like to order patient education brochures for your waiting room, the order form can be found on the right-hand side of the screen under the link Patient Education Order Form. If you have trouble finding what you need, try entering a keyword into the search field at the top of the page. For example, if you type Welcome Packet into the search box, it will bring up the welcome packet we spoke of earlier. If you still can't find the information you are looking for, please don't hesitate to contact us. All of our contact information can be found in the Contact tab in the top right portion of the web page.
Thank you, Kelly. And now I'll provide information regarding creating and managing NC Health Connect portal user account. The information I will provide regarding creating and managing user accounts is all covered in the PAA Quick Reference Guide. You should have received the document along with your login credentials. It was also sent out as an attachment to the most recent quarterly user account audit. Please don't hesitate to email the help desk at HIEsupport@sas.com if you would like for us to send you a copy. A list of topics covered within the document are listed on the side. Managing user accounts. There are some 3 important details. According to the user access policy, there should be no more than 1 level of access per user ID. Keep in mind, Level 5 administrators do not have access to patient information. If, based on your role within the organization, you need clinical access, we ask that you create a second account for yourself. Use the same naming conventions used when your Level 5 account was created. An individual with Level 1 access has no need for Level 2, 3, and 4. Level 1 users have the highest level of clinical access, whereas Level 4 allows access to patient demographics only. The level of access you assign to a user should be based solely on the role they fulfill within your organization. Group memberships are auto-assigned. This selection should not be modified. We have found users lose features rather than gain them. Keep in mind you will not see a change in the group membership as they appear on the user details page. The change is done behind the scenes. Every user should have their own account. Accounts should be assigned to a named individual versus a group, for example, a nursing staff or front office staff. And here's a screenshot of the user details page where role memberships or access levels can be assigned. When you open an existing user account or click Add when creating a new account, you will be brought to this page. Note the group membership box. Do not modify this. Here's a screenshot of the functional roles matrix found in Appendix A of the Primary User Guide, which can be found on the NCHIEA's Training and Tools webpage. Be sure you take some time to visit the page. Not only will you find the Primary User Guide, most helpful for your clinicians, you'll find video tutorials along with previously recorded town hall sessions. Log into your accounts regularly and encourage your staff to do the same. Accounts become inactive after 45 days of inactivity. Log in regularly to maintain an active account. Encourage your users to do the same. Passwords expire every 90 days. Set up security questions so that you can reset your password if you forget it. Encourage your users to do the same. Detailed instructions for setting up your security questions are outlined in the Quick Reference Guide. Included in the Quick Reference Guide is a sample email that you might want to send to your users, reminding them or telling them about their user account that you've created and requesting that they contact you to get the default password. And then also there's an email that you can send reminding them that they may want to log in every 45 days and that they should be changing their password every 90 days. And now I will talk about the NC Health Connect's quarterly user account audit and some frequently asked questions. How often does the NC Health Connect's user account audit occur? The North Carolina Health Information Exchange Authority requires a user account audit to be performed quarterly. An attestation form along with instructions are emailed to PAAs on the second Monday following the end of a quarter. For example, quarter 3 closed in September of this year, and we started sending out attestation forms on Monday, October 8th. As the PAA, what is my responsibility as far as the audit? The attestation form includes a list of active and inactive users. Be sure accounts associated with individuals who are no longer with your practice are disabled. Also included on the form are the number of break the seals and patient searches associated with each user. If a user had an unusual amount of break the seals or patient search activity, you are required to report your findings to the North Carolina Health Information Exchange Authority. Users are required to break the seal in order to open a record for a patient they do not already have an established provider-patient relationship with that individual. Why does the NC-HIE require user audit accounts? To protect your practice and your patient's data, we want to ensure that the NC Health Connect allows only appropriate people with the appropriate access to view patient records. Please note, with your user audit, along with the attestation form, you will get 3 additional documents: the PAA Quick Reference Guide that I mentioned earlier, the instructions for adding text to the PDF, and instructions for adding a digital signature to the attestation form. If you have not completed the Q3 2018 user account audit, please do so now. We're wrapping up that audit. There are 4 easy steps for completing the user audit. The participant account administrator receives an email that contains a report of all active and inactive users associated with their practice. This report is also referred to as the attestation form. As the PAA, it is your responsibility to review and report any and disable any accounts associated with users who are no longer employed with your facility. Note the number of breaks the seals and patient searches associated with each user, and promptly report any unusual activity to the NC-HIE. How to complete the audit. Again, fill out all fields in Table 3, participant information. This includes your organization name, your organization NPI, your address, your name as the PAA, your phone number, and email address. Add a digital signature to the form and return it to HIEsupport@SAS.com. If you're not able to add your digital signature, you may type your name in the signature field. It's best practice to save the attestation form and then open it in Adobe Reader. Utilize the Tools selection to add text or a signature. Be sure to return the attestation form to HIEsupport@SAS.com rather than replying to our no replies email. Be sure your practice does not block emails from Health Information Exchange Communication Do Not Reply or No Replies HIE@SAS.com. Finally, if you have not returned your attestation form, please do so to avoid loss of portal access. And now we'll open it up to questions. We want to hear from you. Utilize your chat feature so we can take note of your questions. If we don't get to you in person this afternoon while we're talking, we will email you separately and address those questions later. If you have something specific to your practice, just please type in the chat feature and we'll get back to you. You can also email us at HIEsupport@SAS.com and we can get back to you that way as well. Aside from questions, we'd love to hear what you would like to see in future town halls, what subjects might be interesting to you. You can do so by adding that to the chat feature, or again, email us at HIEsupport@SAS.com. Did a user ask about the quarterly user audit? If you've got an extension, why do I have to fill out the audit? Please note that once you're given portal access, you're required to submit the quarterly user audit. It doesn't have anything to do with whether you're live in production or whether or not you've got an extension. It's that you have access to the portal and are therefore a user that needs to be audited.
Hi, we have a question about whether or not the slides will be available after the presentation. Yes, they will be on our website, and I can send out an email to all of the attendees with the slide deck attached, if that would be helpful. So I will plan to do that as well. We have a question from a participant. They have received their executed participation agreement, but not some of the other things we were speaking of. If you did not receive the welcome packet, you can email us and we'll be happy to send that to you. or you can find it on the on the web page. Just type in welcome packet in that search box up at the top of the page. As far as the audit goes, that is only sent to participants who have portal credentials. So if you don't have your portal credentials established yet, you would not yet receive the quarterly audit.
I've had a few people ask about the URL to access the NC Health Connect portal. If you would just send us an email to HIEsupport@SAS.com, we can reply with that URL. Thank you. We had a question about the who's going to be will someone be in touch with the PAA once the technical process has started? Typically, our implementation team stays in touch with whomever your technical contact is, along with your EMR if you have one. The first contact we might have with a participant account administrator when we're providing the login, the user ID and login credentials for the NC Health Connect portal. If you have a fully executed participation agreement and you have not received your portal credentials, please know we're working on them. We have an increased number of participants, and we're trying to get to you as fast as we can. We had a question about updating information for staff changes. If at any time the PAA or your primary contact or your email changes or your EMR contact changes, send an email to HIEsupport@SAS.com and we'll be sure your record is updated. You certainly can call us as well at 919-531-2700, and we'll be sure your record is updated. And we do appreciate getting those updates. If we're not getting to your question, we have several coming in. Please email us, and we'll be sure to get back to you as soon as we can.
If we have executed a submission to the participation.
We have a question about a submission-only agreement. And I think there's we actually have a couple questions about that. One is, if we have a submission-only agreement, do we still need to connect to NC Health Connects and send our data? And the answer is yes. The state mandate does require you to send your data. Basically, the difference between just having a submission-only agreement and a full participation agreement is that in the case of the submission-only agreement, you are agreeing to send your data, but you're not getting anything in return from NC Health Connects. So no services are available, including access to the portal. We also had a question about, if I have a submission-only agreement, can I switch to a full participation agreement? And the answer to that is also yes. You would just need to, you can find the full participation agreement on our website under the For Providers tab and How to Connect. Just fill that out and send it to us, and that new agreement would supersede your previous agreement. And at that point, once you have an executed full participation agreement, you would have access to our services, including DSM, NC Notify, and portal access as well.
We have several questions that are more specific to your practice, and we do see them, and we will get back to you. If for some reason we don't get back to you, again, please don't hesitate to call or reach out to you, but we are documenting them. We had another question we'd like to address. What are the benefits of the portal? Kelly, can you talk to that?
Sure. I think the easiest way to talk to that would probably be to provide a sample use case. So if we have a patient that lives in Raleigh and has been diagnosed with something like bipolar disorder, that patient has stopped taking their medicine and visits family in the western part of the state for the weekend. The patient presents in the emergency room with manic symptoms. That physician in the emergency room is able to log into the portal, provided they have portal credentials and a full participation agreement, is able to query that patient and find out about that patient's previous diagnosis, what medications that patient was taking, and also would be able to see that that patient may have just visited the health department and received a positive pregnancy test, which is why they have stopped taking their medicine. So that ER physician who has never met that patient before would have a much more complete picture of the patient in front of them and be able to more effectively treat the patient, and also have contact information, for that patient's primary care physician or other treating physicians to reach out to and help with treatment plan for that patient. So that's just one example of why the portal would really be helpful in treating the whole patient versus just that one encounter. We have a question about DSM and using DSM for referrals. And yes, that would be definitely a way that you could do patient referrals rather than fax. Basically, you can send a DSM message to anyone else that has a DSM account, and it works essentially like a secure email system, and so you can send PHI through DSM in a secure way. Looks like we also have a question about how do we know what our connection status is. Don't ever hesitate to reach out to either our help desk team or us at HIEA@nc.gov. We are happy to share with you what your connection status is. I know that sometimes you just want to make sure that you have done everything on your side that you need to do and are just curious about where you are in the process. And we are happy to help you with that. So don't ever hesitate to call or email us individually, and we can look at your status. I have several questions also about training for staff. I'm assuming that this probably is referring to portal training. We are happy to do that. We have an outreach team that can set up a time to meet with you and do portal training for your staff as well. Please email us. I know we're asking y'all to email a lot of things to us, but that would be helpful if you can email us and let us know that you would be interested in this training, and we can find a date that is appropriate for everyone to help you with that. Someone else asked if the slides will be available after the presentation, and again, yes, I will email them out to everyone who registered for the meeting today, as well as they will be added to our website. I would expect them to be out there within the next week, but yes, they will definitely be available. And we're recording this as well, so you'll have the audio to go along with the slides. We have a question about the types of state funds that are required, or the types of state-funded programs that are required as part of the mandate. So Medicaid, the state health plan, the state health Blue Cross Blue Shield plan, as well as any state grants that your facility accepts, those would all be included in state-funded programs. So at this point, the large majority of our practices are sending all data. They are not parsing out just patients who receive Medicaid or just patients on state health plan. The large majority of our participants are sending everything, but as required by the mandate, any patient data that is related to the state-funded programs, Medicaid, state health plan, or state grants, would be the ones that are required to be sent. And we have a question about the immunization registry. We are working on onboarding people for the immunization registry. I don't have a very detailed update for you right now, so please email me and I will get a better update for you. But I will say that we are working on onboarding folks at this point. And if you are a full participant, you can go through NC Health Connect to do that. There are a couple questions. One, is immunization registry different from NCIR? Those are the same. So NCIR is just stands for the North Carolina Immunization Registry. And there is also a question about the opt-out form for patients and available. Let's see, where is information about the opt-out form? So the opt-out information can be found in the welcome packet. It can also be found on the website. If you go under the For Patients tab, it is also under there as well. It is in English and in Spanish. The brochure order form, which goes through the patient rights and talks about the opt-out process for patients. Many practices keep these brochures in their waiting room. Those can be ordered from us. The patient brochure order form is under the For Providers tab on the website. You just email us that form and we will send you the brochures. One question has to do with what information can be found in the portal. Practices that are live sending data are to be sending ADTs and CCDs. So within the CCDs, there is demographic information, prescriptions, labs, any type of encounter information that patient had with the physician. On a separate note, there was a question about psychotherapy notes within the portal. Psychotherapy notes are not sent to the HIE, as well as anything that is considered CFR Part 2 data. That is also not sent to the HIE. If you have specific questions about those two things, please send us an email so we can address your questions more detailed.
So we're going to wrap up the town hall session shortly. If you have any other questions, please get them to us now. Certainly after we close the presentation, you're welcome to email us, HIEsupport@SAS.com or HIEA@nc.gov.
Hi, there's some specific technical questions coming in about the types of data being sent to the HIE. I am going to refer you to our website under the For Providers tab. If you click on How to Connect, if you scroll down about midway through that page, you will see a link that will take you to our targeted data standards, and that should be able to answer some of the more specific questions about the types of data that are required to be sent. Again, that's on our webpage under the For Providers tab, and if you click on the link that says How to Connect, go about halfway down the page and you'll see some lettering in blue that will be called Targeted Data Standards, and that should be very helpful, hopefully, for you.
Okay, thank you all for joining us this afternoon. Again, if your question wasn't answered, please send us an email and we'll get back to you. Of course, we'd love to hear what you'd like to from you as far as future topics.